Hey everyone, this is Ankit. So I'm going to talk about muscles of upper extremity now. And if you guys saw the first video, we talked about muscles of scapula and glenohumeral joint. Now we are going to focus on muscles of like biceps or brachialis or brachioradialis, mostly the forearm muscles, which are responsible for elbow flexion and all. Not the forearm, but controlling your forearm. All right, so let me share the screen quickly. Okay, here we are in 1 minute. Okay, just give me 1 minute. All right. So if you can remember, this is our deltoid. So I'll just take this one off quickly because you guys know where it's starting. It's originating from your spinoschapula and lateral part of clavicle. Okay, and where is it inserting? It's inserting at deltoid tuberosity. Okay, so I'll take this one off, and deltoid tuberosity is at the shaft level. Okay, all right, let's take this one off. Now coming to let's remove the clavicular head of pectoral, and let's remove the pectoralis minor. Okay, now you guys can see how your biceps. So we are going to start with biceps. So let me zoom that. So you guys can see how biceps, it's like starting from glenoid, supraglenoid tubercle. Yeah, over there. So that's your long head of biceps here, starting from supraglenoid tubercle, and the short head inserts at the coracoid process. So I just removed all the lymph. So it inserts at the coracoid process. That's the short head, and long head goes up and inserts on your supraglenoid tubercle. That's the superior part of glenoid. Okay. And you guys know now, when you have slap lesion, like when you damage the supraglenoid superior labrum at the glenoid cavity, when you damage the superior labrum, you damage this biceps tendon too. So long head, not the short head. Remember that. Okay. All right. Let's zoom it. So let's quickly recap functions of biceps. Biceps is like shoulder flexor. Okay. And biceps is your, if you remember that unique function I told you, when you externally rotate and you want to do abduction, biceps, that long head of biceps is in that plane which allows your biceps to perform this action. Okay, so those patients who have paralyzed deltoid or abductors, they can externally rotate and do abduction. Okay, they can do that. All right, so those are the two heads originating. One more thing about biceps I want to talk about is sometimes when if there is a rupture, let's say somebody rip apart your long head. So rupture of long head of biceps, which is possible during injuries. So one thing that we see in that condition is Popeye appearance. So what happens is when I completely break your long head of biceps at this level, okay, and then if I ask you to have some kind of weight, some resistance in your hand, and ask you to flex. So when you attempt to flex, what will happen is this end, long head, will slide down and bunch up in the distal part of the arm. It will slide down and bunch up in the distal part of the arm, giving you that Popeye appearance. Okay, so that is one thing you should remember. All right, let's understand the insertion of your biceps. Take it up. So what do you guys think? How does your biceps tendon insert in forearm? Let me remove all these. Okay. All right, that's I think more clear now. So if you guys can see now, that's your biceps insert in your forearm. And where is it inserting? What do you guys think? What bone is this? That's your radius. Okay, and it's called radial tuberosity. Radial tuberosity, where it inserts your biceps. So both the heads of biceps, they combine and insert on the radial tuberosity. Okay, not on ulna, radial tuberosity. But then there is something called bicipital aponeurosis, which also goes towards ulna. So this one that you see here, let me show you this thing. That's bicipital aponeurosis, like more fibrous tissues that comes out from the distal part of biceps and it goes down. But the primary insertion of biceps is radius, your radius bone, especially radial tuberosity, top of the radial tuberosity. Okay, so remember that. So radius is like all very much just at the start of forearm over there. Okay, all right. So that's your biceps. Nothing unique about biceps we need to know. Let me do it. That's it. Nothing unique about biceps. All right, now let me take the biceps off. What else do we have now? Which muscle is this just underneath your biceps? Which one is that? Let's take this off. All right, now you guys can see one muscle over there, just underneath your biceps. It goes from down there and actually goes down. That's your brachialis. That's your brachialis. Let me clear this. Okay, now important thing about brachialis is also a very strong flexor. Do you guys know where does it originate? It originates, if you guys can see this, it originates just on the medial side where deltoid ends. So this is your deltoid fibers and they are inserting here at deltoid tuberosity. Okay, and if you see next to deltoid tuberosity more medially, this one is your brachialis. Okay, so remember that from the shaft of humerus, all right, next to deltoid tuberosity, medial to deltoid tuberosity, and it goes down. And what do you think? Where does it insert? Radius, ulna? All right, let me show you. It actually inserts on your ulna. Okay, let me make it bigger. That's your brachialis. So brachialis inserts on ulnar tuberosity. So one has taken ulnar tuberosity, brachialis, and radial tuberosity, biceps. And both of them are ending here. Like this is just a beginning of your elbow joint, your forearm. Ulna and radius are like top part of ulna and radius. Still, these two muscles are very strong flexors. Okay, what do you guys think? Which is the third strong flexor? That's your brachioradialis. Can you recall what's the origin of brachioradialis and where does it insert? Just quickly recall that. And then I'll talk about some important points about brachialis. Brachialis is also a very strong flexor, but I'll explain you why, what's the difference in all three muscles. All right, so what muscle is this one? If you see this distal part of humerus from here, slightly above the lateral epicondyle, right? Let me remove these extra. So that's your lateral epicondyle. And just above that, look at this muscle originating there, lateral to superior to lateral epicondyle, goes down. And what do you think? What's the insertion of that muscle? That's your actually brachioradialis. Oops, not that one. Hold on. Remove that. I think I removed that brachioradialis. Yeah, it inserts over here, but let me bring it back. Yes, this one. Okay, so this one was extensor carpi radialis brevis. That is your just above radial lateral epicondyle of humerus. Above that, from mid shaft area, brachioradialis. Again, laterally. And then, most important part is where does it insert? It inserts on at the styloid process of radius. So this is the styloid process end part. I'll show you in the screen. Zoom it. So just the end of your radius over there, that's the bone. Let me clear this area. Hope I did not remove here. So almost like that's the end of your radius bone. And your most important part is it's on the lateral part. It's sitting on top like this laterally. And that is the reason your brachioradialis is a very strong elbow flexor in neutral position of your forearm. Okay, so because it inserts here, it can work strongly in this plane. If I do this, it's not a very strong flexor then. Okay, because your origin is here of brachioradialis, slightly above, and then it goes there, so it makes it difficult for them to work. But they still work in this position, but not as effectively. They're best in this position. Okay, remember styloid process in brachioradialis. Brachialis from the mid deltoid tuberosity area, mid shaft, and inserts where? Ulna, ulnar tuberosity. Other one, biceps long head, inserts radial tuberosity. Okay. Now, what do you think? When I do pronation of forearm, it's very important. When you do pronation of forearm and then you want to do elbow flexion, that is brachialis, the strongest elbow flexor in pronated forearm. Pronated forearm. Okay. Biceps is the strongest elbow flexor in supinated forearm. I'll explain you in tomorrow's class that how biceps work in supination and why biceps doesn't work effectively in pronation. It's all about muscle alignment. Okay, I'll talk about that. So these three muscles very important. Make sure you guys finish that. One more thing about brachioradialis is, which I'm going to teach you guys in when I teach you peripheral nerve injury. You see this nerve? That's your radial nerve, actually. Superficial branch of the radial nerve, and this nerve is purely sensory. And this nerve gets impinged, especially in this area, between your brachioradialis and extensor carpi radialis. Actually, it's not longest, it's ECRB. It gets impinged between those two muscles, causing loss of sensation in this area. So your radial nerve, superficial branch gets impinged between brachioradialis and ECR, extensor carpi radialis muscle, causes superficial superficial sensory loss. Okay, remember that. All right, so those three muscles are done. Very important muscles, remember that. Let's quickly talk about this thing, bursa. This bursa is present underneath your bone called, let's see if I have, yeah. So this is your ulna, and that's your olecranon process, if you can see that. You know what, that's this part which you use to hit anybody. That's the olecranon process. And on top of that, on top of olecranon and your skin, in between that area, you have that bursa. Bursa is there to prevent rubbing of skin with that bone. There's no other muscle there. It's skin, olecranon, and in between that, there is this bursa present. Why this bursa is so important? Because you're prone to develop bursitis of this bursa. Okay, olecranon bursa gets inflamed, causing bursitis. So anything swollen here, that's the only option you have. Okay, olecranon bursitis, remember that. And if I remove that one, what do you think? What muscle is that next to it? Very small muscle coming from the lateral epicondyle, posterior part of the lateral epicondyle. And where is it going? It's going in your ulna, posterior lateral epicondyle, and medial side of ulna. From there to medial side of, lateral side of ulna. Okay, that is Anconeus, such a small muscle. Remember that from where it's originating. Let me remove this one. It's coming from the lateral epicondyle posterior surface. What comes at the lateral epicondyle? Any other muscle? Extensor carpi radialis brevis, ECRB, leading to epicondylitis, lateral epicondylitis. Just behind that, posteriorly, you have Anconeus. What do you guys think? What is the function of Anconeus? It's originating from humerus, going to ulna. What do you think? Can it do any extension? It can, yes. It's an elbow extension, not very strong, but it is an elbow extensor. How do you want to stretch? How will you stretch that muscle? Just do elbow flexion, that's it. So that's Anconeus. Let's remove that one too. Bursa is done, Anconeus is done. Now if you see there, let me remove this muscle. This one is your brachioradialis. This is gone. And look at this common extensors, starting from the lateral epicondyle. See that how many of them are there, and then go to your wrist, and then do all that. Wrist extension. So they start from humerus, lateral epicondyle, going to the wrist. Remember that. Okay. All right. Let's talk about ligaments. Let's see if we have the ligaments here. Yes, we have it. All right. So what ligament is this one? So this is on the ulnar side. Ulnar side, you have ulnar collateral, and the radial side, you have radial collateral ligament. And these ligaments, they go from humerus, lateral area, distal or epicondyal area, to the to ulna on this side, and the other side humerus to radius. Okay. All right. Same ulnar collateral ligament. That's what you call them, and it has two heads actually. So don't worry about that. And then on the other side, if we can see, let's remove these muscles. All right, so I'll talk about that one. That's the annular ligament that holds radius with ulna. Okay, I'll show you that one. Give me 1 minute. Okay. All right. So you guys can see this ligament, this one, coming from ulna actually. Okay. It goes around your radius. And let me take these other muscles off. It inserts on ulna. So starts from ulna, inserts on ulna. What are they doing? They are the ones connecting radius to ulna, holding it in place. Okay, you can see that. So that ligament goes around your radius. Yes, I have it. So that ligament goes around the radius. It starts from ulna, comes from back there, goes around and attaches on ulna. So basically that's the only ligament that holds proximal radio-ulnar joint together. It's like this. You can see that? How it goes around the radius and holds it there, and radius is prone to dislocate. When that happens, when the annular ligament breaks, it goes down, and that is commonly seen in kids. It's called pulled elbow. When you hold a small kid, young kid, with their wrist and swing around, you break that ligament. Okay, so remember, what's the function of that ligament? It holds radius with ulna, which can break, and that condition is called pulled elbow. Okay, we'll discuss about that tomorrow. Nursemaid or pulled elbow. So that's done, and your ligament is also there. You can see that. Let me remove this annular ligament. All right, so what do you guys think? Which is this? What is this ligament coming from your humerus? Not properly explained. Yeah, not properly explained, but humerus to it holds it there, your radius there. Okay. All right, so we're done with that. We're done with nerve injury that happens at the distal forearm. Okay. All right, one more nerve I want to talk about is what do you guys think about this nerve? Ulnar nerve. Ulnar nerve, let me show you how it's coming from brachial plexus. It starts from there. So in your arm, it's slightly in the anterior compartment, and then it goes back actually. I'll show you where it is. So then it goes behind your lateral epicondyle of humerus. Look at that. Medial epicondyle of humerus. That's the medial epicondyle. Okay, ulnar side is the medial epicondyle side. And so in case if your medial epicondyle slides posteriorly, which nerve is getting impinged? Medial epicondyle sliding posteriorly. Ulnar nerve impinged. Now this is the retinaculum, a ligament. This ulnar nerve actually passes through that retinaculum called cubital tunnel. That's where it gets compressed. Okay, so sometimes this nerve, ulnar nerve, gets compressed between your humerus and this ligament, retinacular ligament over there, and causing compression of ulnar nerve. That's one spot where it commonly gets compressed. Second spot is in your distal area, this part. underneath here. This is your ulnar nerve. Before entering the wrist, it gets compressed over there. That is called Guyon's canal. Okay, so those two things are done. So we finished 3 important muscles. Triceps, we did not talk about triceps, that's fine. So just remember one thing, common extensors originate from here and common flexors originate from here. Let me quickly show you which are the flexors if I can here. I removed most of them. Let me go back. Okay, I just want to see you show you the common flexors first. All right, let's remove these nerves. And don't worry about the nerves. I'm going to teach you peripheral nerve injury in much detail. Okay. All right. So one thing I want you to see. This is the medial epicondyle area, and there are so many muscles lined. These are common flexors. And where are they originating from? You guys can see that. Is that ulna or is that humerus? Let me show you. Let me take this one off. It's your humerus. Okay. Medial epicondyle area. Right, let me take all these to show you clearly. That's the humerus. They are not coming from ulna. This is your ulna. They're originating from medial epicondyle of humerus. Remember, common flexor. Okay. So tell me which muscle is at the top. Which one is at the top? The first one. Oops, sorry. The first one is pronator teres. Okay, goes from epicondyle and goes towards lateral side, towards your radius, from medial epicondyle of humerus to your radius, and that's how it causes. When you do this, it will help you with pronation. Okay? So they have to cross, and the ones below that are flexor carpi radialis should be there. Yeah, carpi radialis, and then palmaris longus, other muscles. Okay, and coming on this side, the one at the top, this is your extensor carpi radialis longus. Where is brevis? Right. Let's find brevis. ECRB. This is the one, lateral epicondyle, and gets injured in tennis elbow. Okay. I think we covered everything. All right. So I hope this was helpful. Keep studying, and we'll keep doing these kind of muscle interaction when we go in the forearm and wrist area down. We'll talk more. Okay. But keep revising, guys. Keep studying hard. All right. In this.